Your Gleason score is the sum of two numbers out of 5, and it is graded by the pathologist on your biopsies. So we're now talking about not the risk of whether you might have cancer or not have cancer. We're talking about a definition of cancer, and this is a marker of the prognosis of that particular cancer and how aggressive it may or may not be. And these two numbers out of 5 totaling 10. But it's important to be aware that cancer only begins at 6 out of 10. So Dr. Gleason, who was a pathologist in the United States many years ago, got it slightly wrong in the sense that anything up to 5 is now internationally recognized as not being cancer. So the lowest grade of prostate cancer that you can have is what is known as a 3+3 or a grade 6 prostate cancer. And that is regarded as a low-risk early prostate cancer, for which, generally speaking, in this country and in Europe, we tend to watch and carry out what's known as active surveillance. And this is because we have very good data from 2 very large American studies where men who only had Gleason grade 6 cancer were followed up for 10 years. And they found that essentially none of them developed metastatic disease, i.e. spread from the cancer, and none of them died from their condition at that point in time. So we are fairly confident that we can watch grade 6 very carefully. The next grade up, if you like, is what is known as a 3+4 or a 7 out of 10, which in some ways is better than having a 4+3. Even though both of them equal 7 out of 10, it's what the first number is that there is greatest of in the specimen. So I liken it to a 7- and a 7+. But both are regarded as intermediate risk prostate cancer, for which we tend to offer a treatment in this country. And then you have 8s, 9s and 10s out of 10, which are regarded as high-grade aggressive prostate cancers, for which you probably need treatment fairly